All right, welcome to this explainer. We are diving straight into what is, honestly, the most crucial technological pivot of our time. Today, we're taking a deep, cinematic look at how silicone is fundamentally rewiring hospital systems from the inside out. To really wrap our heads around the scale of what we're talking about, just take a look at this number. By 2026, the healthcare AI market is projected to hit $40 to $45 billion. I mean, the financial stakes here are absolutely massive, and it's basically triggered a modern-day gold rush among the biggest tech companies on the planet. Okay, let's dive into this, because this quote from the Milbank Quarterly, it really hits the nail on the head. It captures that sort of sci-fi tension we're all living through right now. The code is literally outrunning the law. We're operating in this wild environment where the fundamental rules of medicine are being written on the fly while the technology is already out there operating on the ground. So let's start with part one, the January AI race. This really highlights that tension we just talked about. Just look at this insane 6-day window back in January 2026. On January 7th, OpenAI announces ChatGPT Health. Right? Then 4 frantic days later, on January 11th at the JP Morgan Healthcare Conference, Anthropic launches Claude for Healthcare. And then, literally 2 days after that, Google drops MedGemma 1.5. This was definitely not a coincidence, folks. This was a highly coordinated strategic sprint by these tech giants trying to claim market dominance before the cement of government regulation could actually dry. Moving into part two, let's look at Anthropic's enterprise strategy. Now, what's really interesting about this slide is the stark contrast between the AI you might mess around with at home and the AI a hospital is legally permitted to use. Consumer AI tools, they lack business associate agreements, or BAAs, and they are definitely not HIPAA compliant. But Anthropic took a different route. They designed Claude for Healthcare to be enterprise-ready out of the box. It operates entirely under BAAs through highly secure cloud infrastructures to meet those super stringent security standards for protecting health information. You see, Anthropic made a really deliberate choice to stay away from direct clinical diagnoses. Instead, they built the ultimate back-end operational orchestrator. Claude comes equipped with specialized connectors via FHIR, that's Fast Healthcare Interoperability Resources, so it plugs directly into existing hospital networks. It can instantly check the CMS coverage database for Medicare rules, look up ICD-10 codes to slash billing errors, and automate credentialing workflows. And all of this is governed by what they call constitutional AI, a set of strict principles tuned specifically for clinical ethics. Plus, they have a strict zero-training data policy. What does that mean? It means patient data is totally excluded from the model's memory and is never ever used to train future models. And look, this isn't just theoretical. Michael Reagan, the CTO over at Banner Health in Phoenix, stated that they actually view Anthropic as their anchor point to orchestrate all their other AI. Banner Health is already using Claude to summarize incredibly dense oncology records, and they plan to deploy it across supply chains, revenue cycles, and call centers. And it's not just them. Massive systems like Common Spirit Health in Chicago, Stanford Healthcare, Tampa General, and Rady Children's Health are already on board. Even pharma giants like Novo Nordisk and Eli Lilly are reporting that integrating this AI cut their documentation time from weeks down to literally minutes. All right, Section 3, Google's frontline approach with AMI. Because while Anthropic is dominating the backend, Google is taking a radically different path. And this brilliantly illustrates how AMI works. AMI, the Articulate Medical Intelligence Explorer, uses this really clever two-agent architecture to mimic a doctor's actual reasoning. Step 1 is the dialogue agent. This handles the empathetic, conversational part, gathering the patient's history. Then Step 2 kicks in, the management reasoning, or MX agent. This part seamlessly synthesizes hundreds of pages of clinical guidelines, like BMJ best practice. It's an AI that actually deliberates and critiques its own treatment plans. And the results are, frankly, staggering. During a prospective, real-world validation study at Beth Israel Deaconess Medical Center, they compared AMI against final diagnoses established by human physicians 8 weeks after the encounter. AMI successfully matched that final diagnosis within its top 7 possibilities in 90% of cases. Furthermore, during live patient interactions overseen by a physician, the AI required absolutely 0 safety stops. Incredible, right? Which brings us to Section 4, MedGemma and open source. Because Google certainly didn't stop at AME. Let's move to this next visual and see how this builds out Google's ultimate ecosystem strategy. By offering open weight foundation models, Google is essentially giving these tools away to capture the developer ecosystem and drive up their cloud infrastructure revenue. And MetGemma is specifically trained for complex medical image comprehension. We're talking natively processing 3D CT slices, MRI scans, chest x-rays, and even those super intricate microscopic histopathology patches. But here is where the true futuristic potential lies. Notice how the AI can take totally unstructured, messy electronic health record data, the clinical notes, the scattered lab results, map them into a common FHIR format and turn them into temporal sequences. Basically, it allows the AI to look at a patient's entire medical history as a chronological timeline to answer the ultimate question, what are the risks of future outcomes for this specific patient? Finally, Section 5, Compliance and Liability Risks. We have to talk about the massive legal gray zones hanging over this entire revolution. Because with all this immense capability comes some pretty terrifying security implications. Take Claude Mythos, for example. This is a highly specialized Anthropic model capable of detecting and potentially exploiting cybersecurity vulnerabilities. Its potential is so potent that its public release is currently on ice. Health system chief information officers are watching this very closely, as you can imagine, monitoring the looming shadow of what this could mean for hospital network security. So the crucial point is really this. Compliance is not optional. It is absolutely mandatory. Using consumer-grade AI tools without proper business associate agreements triggers severe HIPAA violations. One single breach can cost millions of dollars in fines. For developers and hospitals alike, failing to use BAA-backed enterprise tools isn't just a tiny technical oversight. It's a catastrophic financial threat. Which leads us to the elephant in the room. The ultimate, unanswered question of the healthcare AI race. When an AI makes a medical mistake, who is legally responsible? Is it the developer who coded the model? Is it the hospital that bought the software? Or the doctor who relied on it? Well, as this Stanford policy brief points out, under current U.S. malpractice law, liability rests on the reasonable physician standard. There is no doctrine assigning shared responsibility to AI systems. We are operating in a complete legal vacuum right now. The technology is out there diagnosing, prescribing, and orchestrating care, but the liability frameworks simply do not exist to handle it. Which leaves us with this final, provocative thought. As these tech giants battle it out for the $45 billion future of medicine, and as silicon fundamentally rewires the hospital bed from the ground up, can the law ever really catch up to the code? Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I'll catch you next time.